Hey there, and welcome. If you're a physician in Dubai with an MBBS or DHA qualification, and you're kind of thinking about what's next for your career, then you're in exactly the right place. We're about to dive into how your clinical skills can unlock the door to some really fascinating, high-demand roles. So let's get real. You're a clinician in Dubai. You have this incredible medical knowledge, but maybe, just maybe, you're looking for a different way to use it. A path that's less about the day-to-day patient grind and more about the critical systems that make healthcare work behind the scenes. Let's explore what that actually looks like. We're going to focus on two really powerful career paths that are in huge demand right now. And the best part? They don't ask you to forget all your medical training. In fact, they totally depend on it. In these roles, your clinical expertise isn't just a nice to have, it's your superpower. Okay, first things first, let's talk about your specific advantage right here in Dubai. Your background gives you a unique head start. And this isn't just about switching jobs, it's about leveraging the amazing expertise you already have. You know that MBBS or DHA qualification you worked so hard for? Well, guess what? It's your golden ticket. Seriously, it's not a roadblock. It's the key that makes you a perfect fit for two crucial roles in what's called the healthcare revenue cycle. You know, the business side of medicine. Think billing, insurance, all that jazz. So let's jump into the first path. All right, path number one, and the most direct route into this world, is becoming a medical coder. This is the role most people think of when they hear about this field, and honestly, for good reason. So what in the world is a medical coder? The best way to think about it is they're like translators for the medical world. They take all the doctor's notes, the diagnosis, the procedures, everything, and turn it into a universal language of codes. And this is absolutely essential because without these codes, clinics don't get paid. It's that critical. So if you want to become a pro, the gold standard is the CPC, or Certified Professional Coder Certification. To get it, you've got to master the three core languages of coding: ICD-10 for all the diagnoses, CPT for procedures, and HCPCS for things like medical supplies. Getting these down is the heart of the job. Okay, listen up, because this is probably the most important tip for anyone in Dubai. Knowing the codes is great, but what employers really want, what makes them want to hire you on the spot, is practical skill. Knowing the local e-claim link system, how to handle pre-authorizations, fight denials, and resubmit claims, that is the stuff that gets you the job. Now, let's talk about path number two. This one leverages your clinical skills in a totally different, and I think pretty cool way. Let's talk about the Clinical Documentation Integrity Specialist, or CDI for short. If a coder is a translator, a CDI specialist is more like a clinical detective. Their job is to dig through patient records and make sure the story the doctor is telling is crystal clear, accurate, and complete. This is where top-notch patient care and accurate billing connect. It all comes down to what's written in that chart. For this path, you've got a couple of highly respected certifications. There's the CDIP from AHIMA, which is really geared towards clinicians like you, and then there's the CCDS from a group called ACDIS, which even has a version specifically for outpatient settings. Now, why is this so often a better fit for doctors? Because it's way less about just memorizing codes and way more about applying your clinical judgment. You'll be the one reviewing complex cases, finding those little gaps in the documentation, and even talking with other doctors to get more clarity. It's a role that truly, truly values your diagnostic mind. Okay, so we've got two really interesting paths, but now let's get down to brass tacks, right? The question's on everyone's mind. How long is this all going to take, and what's it going to cost? Let's break it down. As you can see, the study time for both is pretty similar. You're looking at maybe 2 to 3 months of solid effort. Exam costs are also in the same ballpark. The biggest variable is usually the cost of training, especially for a good course that's tailored for the Dubai market. And just to make it real for you, a typical online training package for the CPC certification here in Dubai, one that includes the course, the exam fees, membership, the whole shebang, is going to run you around 3,655 AED. So that gives you a concrete number to start thinking about. All right, this right here is the million-dollar question. You put in the time, you spend the money, you get the certificate. Does that guarantee you a job? And let me be totally straight with you. The answer is no. There is no such thing as a genuine job guarantee. If any training company promises you one, you've got to be wary. What they usually mean is job assistance, which is not the same as a guaranteed offer. It's just really important to have realistic expectations.
So here's the key takeaway, the thing you need to remember. Your certification is what gets you in the door. It gets your resume seen, it gets you the interview. But what actually lands you the job offer, especially in the UAE, is proving you know the practical, day-to-day workflow of how local insurance claims actually work.
So, with all of that in mind, how do you actually hunt for a job strategically? How do you get the fastest return on your investment? Let's map out an action plan. It really boils down to a simple three-step plan. First, pick your path. Does coding or CDI sound more like you? Go with your gut. Second, while you're studying for the exam, you have to be learning the practical UAE e-claim link workflow on the side. And third, and this is so key, be really smart about the job titles you apply for. So instead of just searching for medical coder, which is what everyone else is doing, broaden your search. Look for titles like Insurance Approval Officer, or RCM Associate, that stands for Revenue Cycle Management, or Medical Claim Specialist. These are fantastic entry points where your clinical background gives you a massive, massive advantage. So there you have it. Two compelling ways you can build an entirely new career on the incredible foundation of your medical degree. You can be the translator, the coder, turning clinical work into data, or you can be the detective, the CDI specialist, making sure that data tells the true and complete story. The only question left is, which path are you going to choose?